President Obama seeks a way to get health care reform passed. He is suggesting that something very important to his political opponents, malpractice law reform, might be on the table. Chief Washington correspondent Jim Engel reports the president favors some dry runs first, which Republicans say are unnecessary.
Well, the president calls them demonstration projects, but quite frankly, we don't need to demonstrate anything. We already know that tort reform works.
Because Texas and California have already taken action at the state level, and it worked.
Texas Texas passed tort reform in 2003, and premiums went down 30%. California passed tort reform, premiums went down 40%.
Until those reforms, Texas was losing doctors in droves.
These are obstetrician gynecologists, orthopedic surgeons, neurosurgeons. In fact, in the south part of Texas, you didn't even have a trauma surgeon that was able to deliver care because of the liability risk.
Tort reform, or liability reform, does not limit compensation for actual damages or loss of income, but often puts a cap of $250,000 on what are called non-economic damages, punitive payments lawyers seek for pain and suffering. A walk-in clinic in Virginia near Washington now asks patients to sign a form that begins by saying all the doctors working at this clinic feel that there is a malpractice crisis that threatens medical care. Then they ask patients to agree to a binding arbitration and the $250,000 limit for non-economic damages. Since that took effect in Texas, doctors have been rushing back in.
And as a result of that, last year, the Texas Board of Medical Examiners licensed the highest number of physicians in its history. In other words, people are coming to Texas that before had left.
Obstetricians can pay $200,000 a year in malpractice insurance, which not only drives up a doctor's cost of doing business, it also leads to defensive medicine, meaning doctors order all sorts of tests they wouldn't otherwise just to make sure they don't get sued.
63% of our members indicated that the risk of litigation or the fear of litigation has caused them to alter their practices.
Another study found 83% of doctors ordered unnecessary tests, which drives up the nation's overall health care bill.
We've seen estimates anywhere from $60 billion a year to $200 billion a year as far as defensive medicine is concerned.
President Obama concedes defensive medicine's a problem, but said last night he does not support limits on liability. Instead, officials are looking at a certificate of merit program in which a panel of experts decides whether a case has merit before it goes to the courts. Interesting idea, but a disappointment to those who thought the president had seen the light on liability reform. Brett?
See where